Hi everyone, I'm Keziah Garvey. I'm here doing my presentation or my speech on wingworms. So wingworm is a common infection of the skin that is caused by a fungus. There are different locations of the body, infection of the body is given the name for wingworms. There are about 40 species of fungi that cause wingworms, and there are different types of fungi known as dermatotypes. Dermatotypes that causes the lesion that is on your body. And here is a microscopic ringworm, and there's a lesion right here in this pointed area. It usually is a circle area on the body. So ringworm has the locations. Like if you have a ringworm on your scalp, it's Tinea capitis. If you have on the ringworm by your toes, it could be Tinea pedis. And if you have it like in the groin area, it's usually from known as jock itch. And if you have it in the beard area, it's Tinea barbae. Most of the time when you get that on the scalp or in the beard is, going to the barber shop where the supplies are not clean. So they just go ahead and, cut your hair and stuff like that. So with transmission, it's usually by skin-to-skin contact from an infected person. Usually we don't know that a person is infected when you can hand-by-hand shake. By if you have cats or dogs or farm animals, you can also get infected by that. And you got like locker rooms. Most of the time, you have kids and family members that play sports, and they use football helmets and stuff like that. They can also be transmitted by that too as well. And in the shower and locker rooms, most of the time it can be transmitted by soil, but through scientific, it's uncertain how it can be transmitted by soil. I guess it's through feces and contaminates with, like as I said, through feces and just urine and stuff from your animals, and just sharing clothes, linens from like I just said, you don't know if the person is infected by ringworm or not until you get it, and then you just sit back and you wonder how you received it. So just be careful and mindful. The symptoms are scaly round shape with scattered red bumps found on the extremities of the body, legs, arms, buttocks, slightly raised overlapping expanded rings on the body, round patch of itchy skin. Symptoms begin 4 to 14 days after contact. So here you can tell that on the body is circular round patch. Inside is just a clear colorish skin. There are risk factors. It could be developing humid and warm climate, having weakened an immune system such as HIV, medication, and diabetes also affects a person that has been infected with wingworm, and sweating and wearing tight clothing. So most of the time you want to wear clothing that fits you, not too tight clothing and you go out and just start sweating. Same thing as wearing your football uniforms and stuff like that. Diagnosis. If doctors look at the infected area and ask questions about the symptoms, they usually scrape the ringworm area of the body where it's located and look under a microscope, or they send it to the lab for culture. And here's a disc with the ringworm, a positive of ringworms. Now there are treatments depending on the severity of where the ringworm is presented, where the ringworm is at. You could, for jock itch and athlete's feet, you could get antifungal cream, ointments, over-the-counter gel sprays. But serious infection that's to the scalp and in the nails, they do require a prescription from the doctor. So you would need to go to the doctor to get medication if it's on your scalp. Treatment and prevention. Keep the skin clean. Don't walk barefoot in public showers and locker rooms. Most of the time we want to go to like Wet and Wild or Aquatica, so stuff like that, and we just wear our, just wear walking there with barefoot, but we don't know that our skin to skin contact and what's on the floor. We're just walking barefoot, or we're walking outside on the grass that's just soil and stuff. So you want to be, careful of how we walk, and wash hands after playing with pets. Yeah, our pets go to the doctor, but they also go outside in their yard and play in the grass and stuff, and then they have they spot where they go and urine, they'll do their thing, and then we come back and we pet them and we rub them, not knowing, hey, that our pet can be be infected by this. So you just want to always keep your hands and stuff clean. Prognosis of ringworm can be cured without appropriate treatment. Resolves within 2 to 3 weeks. Scalp and nails that last about scalp with the scalp and the nails, it lasts longer, but with just regular ringworm through the body, it can last up to 2 to 3 weeks. Complications are rare.